When your doctor tells you you have full-blown cancer, it's frightening.
Welcome to Believe in Progress, the American Association for Cancer Research Foundation podcast. Join us and be inspired by the incredible stories of those who have faced cancer with strength and resilience, and the medical professionals who are working tirelessly to find new treatments and ultimately a cure. Believe in Progress isn't just about the science of cancer. It's about the human side of this disease. Together, we can make progress in the fight against cancer and bring hope to those who need it most. Welcome to the Believe in Progress podcast, brought to you by the American Association for Cancer Research. I'm your host, Mitch Stoller, the Chief Philanthropic Officer at the AACR. Today, we have an esteemed guest, Mayor Michael A. Nutter, the former mayor of Philadelphia and a dedicated public servant with a remarkable career in urban policy and governance. Mayor Nutter has been a champion for cities, public health, and social justice, and has made significant contributions through various initiatives, including Cities United. So join us as we explore his impactful work, his connection to cancer research advocacy, and the future of urban policy. Mayor Nutter, welcome to Believe in Progress. It's quite an honor to have you here today.
Well, Mitch, thank you, and it's a great honor to be here, and thank you for your work and all the work being done at the American Association for Cancer Research.
Mayor Nutter, so you're a lifelong Philadelphian, right?
Born, raised, educated. Been here all my life.
And how did your perhaps early influences growing up in Philly, how did they frame your public service and your thinking about going into public service?
Sure. I grew up in a row house out in West Philadelphia, 55th and Larchwood. Went to the neighborhood Catholic school literally around the corner for elementary school. And then St. Joe's Prep for high school, 17th and Girard, and the University of Pennsylvania for college. Two parents, a younger sister, and my grandmother, my mom's mom. 5 of us in the house. I would describe the neighborhood at the time as probably middle class, right? So everybody's working, but I think most don't have a whole lot of money. When my family moved on the block, we were the third Black family to move on that street. And I think by the time I was around 10 and maybe really kind of paying attention to different things, there were maybe 3 or 4 white families left. So pretty significant turnover during that time. This is also, when I was in first grade, President Kennedy was killed. Of course, as we know in history, a couple years later, Dr. Martin Luther King, Robert Kennedy, Malcolm X, we went to the moon. I mean, Vietnam War. I mean, there's
lots of things going on.
A lot of stuff going on in the 60s, and those were my, kind of growing up years, if you will.
Similar to me, my age as well.
Yeah. So, before community service was a term, I think we were often engaged in community service. It was a tight block. Neighbors looked after each other's kids. Any adult could tell any child on the block, to stop doing something or cut that out, or, that kind of thing. This was a, kind of be on the steps when the street light comes on kind of community. Mm-hmm. And it didn't have to be your steps. It could be somebody else's steps. Right. But you're going to be on somebody's steps.
Right.
Pretty much always letting our parents know where we were. My mother was really kind of big on, don't let me have to come look for you. Mm-hmm. A little later.
Or else, right?
Right. Yeah. Well, she didn't have to finish the sentence. My mom was 4'11", but in my life, much larger.
I'm sure.
Than that. They taught us, my sister and I, treat people with decency and respect, be kind. Always speak when you see someone on the street, especially an adult. You couldn't get away with a whole lot because whatever it was going to be told
Mm-hmm.
by some other adult to your parents, and that was kind of it. Um, every Saturday, which is kind of gets closer to the question you asked. Every Saturday, all the kids are out. We're doing our chores, sweeping down the steps, sweeping down our sidewalk. You know, in my time at least, when it snowed, it really snowed. 5, 7, 8 inches, and my father insisted that when I shoveled our steps and sidewalk, that I literally went to the corner. There were a number of senior citizens in the houses between our house and the corner at 55th Street, and so um, it was a real community. And so I think I brought that mindset, the Jesuit education in high school. Again, the Jesuits believing that you are supposed to be a man for others
Mm-hmm.
and looking after other people. And so, that's really kind of the beginning.
Real sense of community and neighborhood, right?
Total community. Politics was not where I was going.
Mm-hmm.
Didn't know anything about it. Not the family business. Paid
Mm-hmm.
attention.
Right.
City, world events.
Mm-hmm. Why Penn?
Make you
Why'd you go
focus.
to Penn?
Well, I hadn't. I was not originally planning to go to Penn. I wanted to go, quote unquote, away to school. So I applied to Penn State, University of Pittsburgh, and Carnegie Mellon.
Okay.
If you grew up at 55th and Larchwood, those are away.
Right.
Those are
Right.
far
I get
away
it.
places, right?
Yep.
So I went on a site visit to Penn State. It snowed the entire weekend, and I said to myself, I could get this in Philly. So so I actually applied to Penn somewhat late in the process, but I said if I got in, obviously I should go. Great school. I originally wanted to be a doctor, and I went to Penn pre-med. I was a biomedical engineering major. Chemistry 3, which is the first semester chemistry course. Chemistry 3 changed my life and pointed me in another direction because it was clear.
You weren't going down that path.
No, I was on the path of getting an F.
Why were you interested in med? I'm wanting to become a doctor.
Yeah, it's back to wanting to help people.
Okay.
I worked in a pharmacy,
Mm-hmm.
the neighborhood pharmacy at the corner of 56 and Larchwood. The Sneidman family.
Mm-hmm.
They were one of the families that stayed. It was a classic, corner store. I mean, corner property was the pharmacy,
Mm-hmm.
and then the family lived upstairs. The dad, the older Sneidman, was a pharmacist, and his son was a pharmacist as well. They went to, at the time, Philadelphia College of Pharmacy and Science.
Right.
Out
Which is
in
university.
Southwest.
Mm-hmm.
Yeah. And so to get a job there was a big deal. I worked there 6 years, from 8th grade through my freshman year in college. And so that experience started me, thinking about medicine. I saw what the family did and how they interacted with people. Again, issues of medicine, healthcare, and the like, but also community.
Mm-hmm.
Again,
Mm-hmm.
there were so many times I would see Dr. Sneidman, the father. Someone might not have enough money to pay for their whole thing, and he was like, just take it. We'll deal with that next time.
Nice.
And I witnessed that so many
Wow.
times. Fighting for people to have the health care that they needed to get their medicine, those kinds of things, way before.
Refreshing thought.
Yeah, way before ACA and
Right.
and even the big drugstores. This was a single store, single owner, family business, and I saw medicine and community service in action. So that was the inspiration behind wanting to be a doctor. Like I said, chemistry course changed my course.
Right.
So but I always had an interest in business and entrepreneurism, and so I switched majors. Eventually, entrepreneurial management, and eventually transferred from the engineering school where I'd been admitted, ultimately to the Wharton School,
Right.
and finished up my time there.
I see. And then when you graduated, did you initially go into politics, or did you go off and
No,
got a corporate job?
I still was not thinking about
Okay.
politics at all. I was well, when I was in college, after our freshman year, my best friend from high school, and fortunately I have two, both from the prep. Um, but one of them, his dad owned some bars and a club, um, in mostly in North Philadelphia, and I became very close with the family. It's Robert Bynum, who's an entrepreneur in the city, owns restaurant south up on North Broad Street, and has had other restaurants in the past. But anyway, um, we've been best friends since freshman year of high school, and his dad opened the first black-owned discotheque in the city. Some of the listeners might have to Google that, what a discotheque is. But
Right.
we started working there. It opened in the summer of '76, and that was the summer between our freshman and sophomore year. So I was working at the club, graduated from college, continued to work at the club, but then took my first corporate kind of job at Xerox at 17th and Market. So I was working Xerox in the daytime and the nightclub at night. You can do that kind of stuff when you're 22, 23
Right, of
years
course.
old, right? I'm burning that candle, very, very long. And I stayed at Xerox 21 months, and decided that since they did not see that I'm saying that hopefully your listeners can see this is a major tongue-in-cheek kind of comment, but since Xerox could not see the future brilliance, I decided to quit my job, and I thought I should have been like a senior vice president by that point, uh, which of course would be absurd. But while working at the club, at the nightclub, and this is mid '70s into the '80s, I met a lot of people in politics. As I mentioned, this was the first black-owned discotheque in the city. The mid '70s, early '70s, mid '70s, the rise of black elected officials, people of color running for office in offices all across the United States, and so, you know,
In Philly at that time, though, was that
yeah,
a new trend?
it was growing.
Okay.
So you had Hardy Williams ran in '71. Actually, that was the year that Frank Rizzo won. Charlie Bowser ran in '75. Bill Gray ran for Congress in '76, lost, came back in '78. People like Marion Tasco and Augusta Clark and John White Jr. and Dave Richardson. I mean, all of these names of people. And I met these folks at the nightclub. So I'm 19 years old, my buddy and I, and we're witnessing, the growth and the rise of and the change in the political environment here in the city of Philadelphia. And so, it was really kind of amazing to watch it, to be standing by, and I became that much more interested. And so in the early '80s, after I quit my job at Xerox, and I'm still working at the nightclub, I have daytime hours free. My buddy Robert and I started going to City Hall to see different things that were going on. We went to city council meetings, which of course are open to the public. And, as they say, one thing led to another. I eventually met Councilman at Large John Anderson, started volunteering in his office. This is '81 into '82, after I left Xerox. And then he was running for re-election in '83. '83 was a pretty big year, not just in Philadelphia, but also in Chicago. Harold Washington, Philly and Chicago in the same election cycle. So Harold Washington was running to become the first black mayor of Chicago. Wilson Goode was running in Philadelphia to become first black mayor. So Harold Washington wins in February. Wilson Goode wins in May, Democratic primary. John Anderson wins the Democratic primary, comes in first out of 57 candidates who ran at that time. And May 17th, 1983, I decided this is what I want to do.
And so, where do you put your hat into the council? Is that
Yeah.
kind of the first?
So that summer, I went to work for a guy by the name of Malcolm Pryor. He had his own investment banking firm, one of the largest black-owned investment banking firms in the country. He had a seat on the Philadelphia Stock Exchange, and so when there was actually paper, kind of like when the scene from Trading Places, the movie. And so I interned that summer um, on the floor of the Philly Stock Exchange, and of course I was still working at the club. And so that summer, in discussions with Councilman Anderson, we started talking about my future. And so I was going to run 4 years later in 1987. He was a councilman at large, and I was going to run in the district where both of us live, the 4th District. Unfortunately, the councilman died about 5 months later in October of '83. That kind of, to some extent, blew that plan up. Very hard, very tough on me. I was 26 years old. He was my political mentor, and it's kind of some tough lessons learned
Sure.
in politics. Met a lot of people, some of whom decided, well, your guy's dead. You're a kid. Don't need to talk to you.
Right.
You're kind of cast to the side. So, like I said, some tough lessons learned pretty early on. But circumstances changed. I a city councilman the next year in '84 actually committed suicide. And so obviously there was a vacancy. Angel Ortiz, who had run in '83 but lost
Hmm.
in the council at large race, was put forward by Mayor Good as the replacement. Ortiz and Anderson were good friends, and I had met Ortiz before. So he asked me to run his special election campaign. This is 1984. This is Mondale Ferrero
Right. Yeah.
presidential
Sure.
race,
Hmm.
right? Um, they lost, but Ortiz won,
Hmm.
and then I went to work for him as chief of staff and legislative assistant. Keep in mind, I was already planning to run myself in
Right.
'87, so
Right.
I told him, I said, "Look, I can only stay here about a year or so
Hmm.
because I need to move on so I can get my own career
How
started."
old are you at this time?
I'm uh, I'm 27.
So it's pretty young. Yeah.
Yeah, yeah. So I did that. Stayed for about a year, 13 months, and then I went to work for Ed Rendell, who was running for governor for the first time.
Right.
Um, and then in '87, I ran for city council. Ed Rendell ran for mayor. We both lost, that year. It was close, but as they say, close only counts in horseshoes and hand grenades,
Right.
right?
Right.
Um, so I went back to the investment banking firm, and then ran again in '91.
Lessons learned by losing.
Um,
Not that you ever want to
I
lose.
hate losing.
Yeah. So do I.
But what I tell my students, I teach at Columbia, actually, which I didn't appreciate it at the time, but you actually learn more from a loss than from a win. It should force you to re-examine everything you did, the whys and wherefores. No one else to blame. You're the candidate. Circumstances sometimes beyond your control, but you have to figure it out. And so, I knocked on 10,000 doors in '87. I knocked on 20,000 doors in '91. I raised more money than the incumbent. I got more involved in local neighborhood politics. I garnered more support. So I mentioned earlier Congressman Gray, who heavily supported me in the '91 race. But also, there was a change in mood in the circumstances. The city was going through a financial crisis. Voters were angry. Anyone who was an incumbent actually was kind of in danger.
Hmm.
Um, and I think even in the loss, I think I seemingly kind of represented myself well. Had a lot of support, obviously just not enough, but people still wanted to support me, um, and I think we're kind of excited that I decided to run again, which I was always going to do. And so uh, the the politics shifted, the electorate mood shifted. People wanted new. They wanted change. They wanted a difference. They didn't want the city going through, on the verge of bankruptcy. And so Ed Rendell runs again in 91,
Mayor. Hmm.
and wins, rescues the city, financially. Um, at the time, I think the largest class of new city council members came in 92, again, because the voters wanted change.
Hmm.
And so it was a great time of learning. I was an active city council person, and one of the things that I worked on that I'm most proud of is the citywide smoking ban. Um, I worked on that for 6 years. It was tough. It was a fight. It was brutal.
Probably a big lobby against it, right?
Massive. Yeah, yeah, yeah. Big tobacco. They call them big tobacco for a reason. They're big.
Yeah.
They spend a lot of money. Also spread a lot of lies.
Talk about cancer issues too, right? Smoking, tobacco.
Sure.
I mean,
Yeah.
did that come up, by the way, in this
Oh,
fight?
it was the whole thing. It was
Okay.
the centerpiece of the campaign because it was after they had lied for decades that smoking didn't kill you. Then the new thing was, well, there's nothing wrong with secondhand smoke, right?
Right.
So think about that. So I'm not smoking, but you're smoking. You blow it out of your mouth
Right, and I'll
or
be okay.
nose, right? And I'm
Right.
going to be fine, right?
Right.
This sounds really crazy, but they're on an airplane, right? They used to pull the curtain,
Right.
and that was somehow separating
Right.
the smoke from the
Right.
clean air on an airplane,
Yeah, right.
right? No smoking section
Right.
in a restaurant,
Right.
right? As if the smoke knows to stay, right? So, and I mean, they were absolutely lying. And when there was a big tobacco settlement case, and I think like millions of documents were released publicly, and we found, I mean, I read a lot of stuff, but one of the things I found was basically, I don't want to use a legal term, but certainly some level of coordination between actually the tobacco industry and the liquor industry.
Hmm.
Because what the big lie was, not only is secondhand smoke not bad, but that they cranked up the liquor industry, bars and restaurants, saying that they were going to lose money. Workers were going to lose tips, that, people like to drink and smoke, which generally is true for some, but they also stay longer,
Mm-hmm.
right? They're enjoying themselves, so bigger tips for the workers. And I mean, they mounted this massive campaign that, that bars and restaurants were going to close, people were going to lose their jobs, puppies might be thrown off a bridge.
TV ads and things like
Bridges.
that?
No,
No?
localized
Okay.
mostly.
Mhm.
Yeah, yeah. I mean, again, this is back in 2000.
Yeah.
So, there was no real social media or anything
Right.
like that. Maybe some blogging or something like that. But that was early days. And I mean, they just kept at it. Fortunately, places like New York, the city, New Jersey, and a number of other jurisdictions were passing these laws. And so, I mean, it wasn't completely wild and bizarre. The key for us here in Philadelphia, actually, I never brought the bill to a vote because I didn't have the votes and I didn't want big tobacco to win.
Right.
But later on, we switched tactics. Initially, we primarily just talked about the health side. Later on, I switched tactics and we talked about clean indoor air, worker protection law, and made it about bar and restaurant and other workers, that people should not have to risk their lives to hold down their job. That when they're in that environment, when you and I go to a restaurant, maybe we're there for an hour and 15 minutes, maybe an hour and a half,
Mhm.
really good meal, right?
Mhm.
And then we leave.
Right.
They're there, sucking in all of that tobacco particulate for 8, 9, 10 hours a day. It's in your clothes, it's in your hair, it's in your skin. Then you go home, to your kids. We have significant asthma issues, for instance, one of many healthcare challenges, health disparities in Philadelphia. And so the workers actually started speaking up on the issue. And not all the restaurateurs were opposed. They were nervous, and I understood that. But a few of them, one in particular, Ellen Yin, Fork and
Mm.
A Bar and um, some of her other places, she was willing to have a conversation. And I think in that community, really kind of went out on a limb to express, acknowledgement and some level of support. Um, and then my colleagues on city council, and I mean, there was tremendous pressure coming down from bar and restaurant community, and certainly big tobacco in the background. But eventually supported the legislation. That was in 2006, and then about which was like last session of city council that June that summer, and then about 2 weeks later, I resigned my seat in city council to get ready to run for mayor.
And when was the mayoral election?
Mayoral was the next year.
Okay.
Democratic primary. The primaries May of 2007.
Who did you succeed?
John Street.
Okay.
Yeah, he was. Yeah, we have a 2-term limit,
Mhm.
so he was termed out, or was not eligible to run, and so I had taken a poll in May of 2006, because in my mind, at least, I hadn't announced publicly, but in my mind, I mean, I pretty much decided I'm going to do this, but I wanted to have some data.
Mhm.
I think it's important, and I'd done the smoking ban and police advisory commission and campaign finance reform, all this stuff. Nothing like a poll to help remind you that you're maybe not as popular as you think
Okay.
you are. And so the poll said I had about 12% name recognition,
Okay.
and that no matter who ran, I would likely be fifth in a 5-way race.
Okay.
It was my own poll that I paid for.
Right.
That was in May of 2006, and then I resigned in June of 2006 with a poll that told me that I couldn't win.
Right.
Yeah,
And you won.
I did.
How did you pull the win off?
Well, first, I mean, notwithstanding the poll results, I actually did think I could win. So I think positive mental attitude goes a long way. Secondly, I had a tremendous amount of support, and what was often said about me was that I had no known constituency. I'd never run citywide, and I probably would not be able to raise the money necessary.
Mm-hmm.
But first and foremost, um, I'd been in city council. I was in my 4th term. Um, you know, fairly well known and decent reputation, all that. But most people just thought I would never resign, because you have to resign to run for another office.
see.
And so when I did, I mean, it was really kind of sending a pretty serious message. As it turns out, I was the only candidate in the race who actually had to resign their job to run for an office that nobody thought I could win. So it actually created, in a weird way, a certain level of credibility about the campaign. I was also the only person who had actually worked in city government, so I could talk about the issues that people cared about with a certain authenticity.
How many people were running at the time?
There were 5 of us in the Democratic primary, and I mean, serious heavy hitter folks.
Mhm,
2 members
mhm.
of Congress, a powerful state rep, and an independently wealthy business person. So, and then kind of little old unemployed me. So, it was a real kind of Dave and Goliath kind of situation. But our campaign just kept growing. People kept giving us money. Folks kept volunteering. I went to all the different forums and that kind of stuff. We had great commercials, one of which featured our daughter, which we ran 10 ads in the campaign. The only one that people remember is the one with Olivia. So she takes certainly full credit for the win, and has reminded me pretty much since she was
I'm sure.
since she was 12 years old. She's 29 now. So no, it was an incredible experience, an incredible campaign, and it really was a number of different constituencies kind of all coming together. People wanted good government. They wanted fiscal responsibility. They wanted real talk about real issues. And
I know you're confident, but were you surprised?
well, so our pollster told us probably 2 weeks before Election Day that we were going to win.
Really?
Yeah. Yeah. He called it. He said it was going to be 12 or 13 points, and it ended up being 12.
Really?
Yeah. Yeah. So,
Wow.
yeah, we kind of knew we were going to win.
That's pretty cool.
Yeah, it was very cool. But I mean, there's getting that information, there's believing it. But I mean, that night, when the race got called, it was like, I can't believe this. This actually happened. This kid from 55th and Larchwood is
great
about to become
story.
mayor of his hometown.
Have you ever written a book yet?
I did.
Yeah.
Yeah, it's called Mayor, the Best Job in Politics.
Right.
Yeah.
I think I saw an interview with you and Jonathan Capehart
Yes.
at Aspen. He was talking a little bit about that.
Yeah.
Oh, nice.
Yeah.
What was it like being mayor of this city?
It's an incredible honor. It's a huge job, tremendous responsibility, and you should treat it that way. You cannot please everyone. Most of the people who try don't get anything done. But what I've often said is, if you have a deep-seated need to be loved and admired on a daily basis, this is not the work for you. You should go work in a pet shop. You have to figure out how to do the right thing by way of the public.
And that can be tough because you have to make
It can be
tough
very
decisions.
tough. Make tough decisions every day. That's the job. So again, don't go into it lightly. Everyone's not going to be thrilled with everything you do, including sometimes maybe even your family.
Right.
My mom wasn't thrilled with everything I did.
Right.
But I had a sense that she still loved me.
Did you deal with health disparities at the time?
Yeah.
I'm thinking more of cancer health disparities and the issues around that today, but
Yeah.
back then.
Well, I touched on, we had, and may still to some extent, asthma, respiratory issues, obese and overweight conditions, significant amount of disparities in a city that is the premier city for healthcare,
Right.
and healthcare institutions and research, et cetera, et cetera. So there's a bit of a gap or disconnect between the level of care available and the level of care that people get.
Right.
Right? And so we, in the midst of, we had the recession during my first term, but great leadership over on the health side. Dr. Don Schwartz focused on obese and overweight conditions, focused on numerous healthcare disparity issues, led out in the open and in residential environments. And so everyone knew what I wanted. I wanted the citizens to be safe. I wanted them to be healthy. I wanted people to prosper. I want folks to have jobs. I want kids and those who are young at heart to have a great educational opportunity. And so you take on these challenges with, you have to have integrity and transparency. Explain to the public why you're doing what you're doing. Acknowledge that you could actually be wrong. That does happen, and that you don't have a franchise on great ideas. Many of the things that we did when I was in office as mayor, or even as in city council, were ideas, suggestions, thoughts that came from the public, and so you need that partnership.
Mm-hmm.
I often said, we certainly don't have all the answers, and some days we don't even know all the questions.
Mm-hmm.
And so tell us.
Mm-hmm.
If somebody has a better idea, I want to do that idea.
Right.
So don't get stuck on your own stuff. Don't fall in love with the sound of your voice and the things that you've written down on paper.
You miss it?
I miss my people. I had a great team. It's really a family. I still stay in touch with many, many, many of the folks that I worked with at the time. You go into it knowing the first time you win, you get 1,461 days. And if you're lucky, you get 2,922. The moment you put your hand on the Bible and raise your hand and take the oath, the clock is ticking. toward a day that you're going to leave. And so I liken it to, not that I've ever run one, but I've seen it. I liken it to a relay race. You start with the baton, you run your leg, and you hand it off, and you run off the track. Just run the best leg that you can.
Right. Very interesting. Can we talk a little bit about your cancer journey?
Sure.
Could you just chat with us a little bit about like the initial diagnosis and
Sure.
and how you felt about it and things like that?
So, I've had a great I've had a great urologist. My other best friend is actually my general practitioner.
That's a good thing.
Yeah, comes in really handy. But I've had a great urologist, Larry Belkoff, and when I turned 50, both doctors were suggesting, it's time to, get a PSA.
Yeah.
I, not exactly sure. It seems like a long time ago. Not exactly sure I even knew what it was, but read about it. Okay, blood test, digital exam, did it. Nothing to it, and in those early on days, no issues at all. I tried pretty much successfully, I think. Every summer while I was in office, I would kind of do the full array of, eye doctor, ear, nose, and throat, urologist, dentist, just kind of knock them all out in the course of the summer. So I think for the most part, I pretty much had annual PSA tests. Later in my time, toward the tail end of my second term, we started seeing some movement, upward movement in my PSA number. Not alarming, but movement. And so that's when he explained to me about, I think it's called active surveillance. And so we actively surveilled for a number of years. And the movement was not significant, but there was movement. After I left office, now trying to figure out, kind of the next chapter, probably not as diligent as I should have been. And I would, kind of periodically saw more movement, and I know he was getting concerned, but he said, let's just keep an eye on it. Then kind of fell off schedule again. And then in 2020, in the midst of the pandemic, we're all kind of tucked in our homes.
Right.
And one day, so my wife was, she had kind of commandeered the first floor. I'm up in the office on the second floor. That's how, it's how everybody's working, stuck in the house.
Remember it well.
The whole thing, right? So this one particular day, it's a Friday, September 11th. I wasn't feeling well, and felt like I had like some indigestion. I knew I had a big meal the night before. Felt a little tired, and I had a break in Zoom calls. I'm upstairs again. She's downstairs, and I just decided I'm going to lay down a little bit, just kind of get myself together. Well, she happened to come upstairs. I'll spare your audience what she actually said, but it can be a version. She's like, "What are you doing? Like, it's 1:00 in the afternoon.
Right.
Why the hell are you in bed?"
Right.
I said, "Well, I kind of don't feel well. Feel a little warm." I said, "Well, did you take your temperature?" Well, I don't know. I don't know where the thermometer is. Classic,
Right.
male response. So she's getting a little agitated. We get the thermometer. My temperature's up. I don't feel well. Got a little pain, and the instant thought is that I have COVID.
Right.
Right. Got 3 or 4 of the signs. So she's like, "All right, well, basically get your ass out of here. Go over to University of Pennsylvania. So call my doctor. What's the advice? Because I think we didn't have tests yet. And so he said, well, go to the emergency room. Tell them your symptoms. They'll do a test there. I go to the emergency room. My temperature's up, blood pressure's up, still really not feeling well. And they do the test. They come back. I don't have COVID.
Negative.
I'm like, great. And they're like, well, but you got all this other stuff going on.
Right.
So, not so fast, buddy.
Yeah.
Next thing was blood work and a CAT scan. They came back. All right, well, we know what's going on. Your appendix has burst. Okay. So that was about, 6:30 something to 7 in the evening when
You
that
must
came
have been
back.
in pain.
It really was.
Wasn't-
People have asked me that numerous times. I literally thought I had indigestion. I think apparently I have a high pain tolerance. But I've been told it's very, very, very painful. But I wasn't feeling that. So anyway, about 1 a.m., I was on the operating table and emergency appendectomy. So it's Friday into early Saturday morning, went to surgery. They kept me overnight Saturday. And while I'm laying there, I'm like, I actually haven't stayed in a hospital since I was 17 years old when I had my tonsils out. And so, I got some time to think. And I'm like, I should probably get a PSA because I haven't had one in a few years. And we were seeing that movement. And so I called my doc. I said, look, this is what I'm thinking. I know I haven't had one in a while. And so I'm recovering from the appendectomy. I get the PSA. I mean, I'm like, you didn't have to be Marcus Welby to figure this out. I mean, when I saw the number, I was like, oh, I think active surveillance is over.
Skyrocket.
Yeah. It's in the teens. And so and I called him and he said, yeah, it's time. And so he told me the options, helped me find a surgeon. He explained further the options. I immediately decided surgery as opposed to radiation.
Right.
But the question you asked, when your doctor tells you you have full-blown cancer, it's frightening. A lot of thoughts start going through your mind. A lot of fear, doubt, second guessing yourself, decisions made or not made, and kind of the realization that I probably should have dealt with this a while back.
Second guessing that you should have had your test done earlier.
Yes.
Yeah.
Not even second guessing. I mean, it's like it's
what I should have done.
It's the reality, right?
Yeah.
And so that was in late October, early November. Met with the doc, great guy. David McInnes was my surgeon. And December 9th, 2020, had prostate cancer surgery. Came through it. I'm not that old, but I guess I am old because I had a lot of old thoughts or things I thought I knew. Hadn't heard about robotics, laparoscopic surgery. So I'm operating with the old information of, you're going to cut me wide open. It's going to take forever to heal. I won't be able to work.
Right.
I got to earn a living, take care of my family, all this, kind of worse male aspects of some of the things that we think about when we should be thinking about other things.
Right.
And so all of that old thought was not only old, but wrong. Nowhere near as long a recovery time as I thought. Nowhere near as any kind of pain management. Particularly with the robotic surgery, tremendously precise. And it was just completely different than anything that I had been thinking, which was part of the reason I think that I just kind of didn't want to deal with it.
Mm-hmm.
I think the other part was I just didn't want to acknowledge it.
Right.
I wasn't ready.
Right.
And that goes back to fear. And
How'd your family deal with the news?
yeah, well, that's a whole other story. Because I didn't tell my family until probably 2 weeks before surgery.
So even after the hospital episode,
Yeah.
right? No. Okay.
No. So for everyone listening, as I've said numerous times, the worst decision of all the decisions that I made, the absolute worst decision was not addressing this issue with my family much earlier on.
Mm-hmm.
And they were rightfully, both upset and a little pissed.
Mm-hmm.
And I was like, well, I didn't want to burden you all, and I wasn't ready to deal with it, and, all kinds of, pretty lame excuses. But, what I've come to say that, guys in particular, not all, we have an amazing ability to not deal with things that we should deal with,
Of course,
especially health,
yeah.
Right? That pain, that's just, that'll go away. This thing, yeah, I'll get to that. Well, but I got to work, I got to do this. I got to do that. I got to do the other thing. And in our heads, we've got to figure out how to say, and I got to take care of myself. Right.
Absolutely. I deal with a group, by the way, called Man Up to Cancer. And they really, it's dealing with male issues.
Yeah.
Because men don't want to talk about their issues, right? Nope. Be it prostate cancer or glioblastoma or whatever it might be.
Nothing.
And they're doing a really great job of getting the word out. I think your message is a very important message to send out to the folks out there.
And that's one of the reasons, I want to be involved with you all and, other groups that are doing this work. As my daughter likes to remind me, Dad, you bought that lesson. But I don't want other people to have to go through that.
Right.
And I feel very strongly about it. I am very fortunate. Even though I waited later than I should have, I think the active surveillance certainly did help. And just, I don't know, coming to my senses.
So
at some point.
Are you getting testing now? Do you test blood now, like every 6 months?
Okay. Yeah. Just had one 2 weeks ago.
Things are good?
Things are great.
That's awesome.
Undetectable.
Yeah. That's really, really good.
Been for a couple of years now.
Really good. So what message do you have to cancer patients or people that are recently diagnosed out there, regardless of what the issue is?
Well, don't do what I did.
Right. Don't do what Mayor Nutter did.
No, not on this one. Talk to your family. And, like I said, rightfully, they were, upset, if not a little pissed off, but got through that. And on the other side of that, I think the main reason for a very quick recovery was the love of my family. Both my wife and daughter being there. My daughter happened to be home at the time because it was around Thanksgiving. The love and support of family, I think, is critically important. Do what your doctor tells you to do. Follow all the instructions. Get tested. Keep getting tested. Know your number. And whatever it is, you got to own it. Unlike some other diseases, I was doing my thing and I'm running around and, all right, maybe I was going to the bathroom a little more. Maybe I probably ignored that, right? But, prostate cancer doesn't have generally a lot of outward signs,
right?
Unlike some other diseases, right? If you have, respiratory issues, you pretty much know you have respiratory issues, right?
Yeah.
And so, everyone's different, no question about it. But in this day and age, no one should really die from prostate cancer.
Correct.
Right. And so what took me to where I needed to get to when I was laying in the hospital from the appendectomy was basically the idea, look, I know I'm not going to live forever and something's going to take me out of here, but it doesn't have to be that.
Right.
Right. And I can actually do something about that, unlike some other things. And so get tested. Black men in particular, higher prevalence
Much higher incidence.
of prostate cancer in African-American men, but also caught early, better health outcomes
Right.
for African-American men. So I try to get that message out as much as possible. If you have family history, I think probably no later than 45. If you have close relative, especially if you're a person of color, probably start getting tested at 40. No matter who you are, no matter what's going on, minimum at 50.
Right.
And then, unless your doctor tells you otherwise, just kind of once a year.
Right.
Look, I think for a lot of guys, the actual PSA tests, that's just blood work. I think many of us struggle with the digital exam aspect. Takes maybe about a second. And so I like to remind guys that, you're worried about that. Do you know what a woman has to go through to get a pap smear? Right? The syrups, the cold instruments, like serious pain, right? And you're worried about a thing that takes a second, right? If you care about yourself, if you care about your family, if you want to be around for birthdays and holidays and do a whole bunch of other stuff, get tested, take care of yourself, know your number, and keep it moving.
Well, Mayor Nutter, can't thank you enough for giving us a few minutes today. And by the way, folks, Mayor Nutter has been supporting the AACR. We're actually going to honor Mayor Nutter on October 27th here in Philadelphia with our Party with a Purpose event. We're very excited about that. But more importantly, thanks for getting the message out and the word out. That's critically important. Education is really, and prevention is really an important issue. Great honor for me to meet you today, and thank you for everything you've done for the city and for the country. Really fantastic.
Thank you and the audience. But this great organization, American Association for Cancer Research, you're going to save lives and make a difference in the quality of life that people have. So I'm honored to just be a small part of this.
Thank you so much, sir.
Thank you.
Thank you, Mayor Michael Nutter, for sharing your invaluable insights and the impactful work you have done throughout your career. For our listeners, today's conversation underscores the importance of leadership, innovation, and dedication in driving progress in urban policy and public health, and highlights the critical role that advocacy plays in advancing cancer research. For more information about the initiatives discussed and how you can support the advancement of cancer research, please check our show notes for more information. Remember, progress in cancer research and urban policy relies on the collective efforts of dedicated individuals like you, our loyal listeners, and leaders like Mayor Nutter. Thank you for tuning in to the Believe in Progress podcast. Let's continue to support and inspire one another in our shared mission to fight cancer and improve our communities. You can support life-saving cancer research with any donation you make today. Until next time, keep believing in progress and the difference we can make together. This podcast is produced by College Cast, LLC.